So if you've ever had that nagging, chronic low back pain, you know the big debate, right? Should you be doing exercises or should you see someone for hands-on manual therapy? It's a question millions of us ask. Well, a major scientific review from the Journal of Bodywork and Movement Therapies has a really surprising take on what the science actually says.
And just to put this into perspective, look at this. We are not talking about a small problem here. Low back pain is the #1 cause of disability worldwide. That's huge. It's not just an ouch, my back hurts kind of thing. It literally stops people from working, from being with their families, from living their lives. And that's exactly why we have to figure out the best way to treat it.
All right, so here's how we're going to break this down. First, we'll talk about the ache we all know. Then we'll get into exercise, the go-to treatment. We'll ask if hands-on stuff actually helps, see what the research found, and then, put it all together at the end.
Okay, first things first. Let's really get on the same page about what we're dealing with here, because this is an ache that a ton of people across the globe know all too well.
So the key word here is chronic. The researchers are zeroing in on chronic low back pain. And what does that mean? Well, basically, it's any pain, muscle tension or stiffness, in that area below your ribs but above your glutes that just hangs around for more than 3 months. This isn't about that one time you lifted something heavy and were sore for a week. Nope. This is the persistent stuff, the kind that really starts to change your life. And the thing is, the impact goes so much deeper than just the physical pain. This is what the source material really drives home. It's not just about your back. It messes with your ability to work, to do everyday things. But here's the kicker, it's tightly linked to your mental health. We're talking a higher risk of anxiety and depression. It can even make people feel totally isolated. So it's not just a body problem, it's a whole person problem.
Okay, so what do we do about it? What's the standard playbook, the first line of defense? Well, for years and years, the answer has been pretty clear. Exercise. Let's dig into why movement is so often called medicine.
Now, when we say exercise in this context, we're not just talking about, hitting the gym randomly. We're talking about exercise therapy. It's a much more targeted approach. It's all about specific prescribed movements that a professional gives you to correct an issue, restore your function, and just generally maintain your well-being. This is like a core principle of physiotherapy.
And there's a really good reason it's the go-to treatment. The evidence is just rock solid. Look at all these benefits. It's not just one thing. It strengthens your core, it makes you more flexible, and it cuts down on that awful stiffness. Plus, and this is huge, it boosts blood flow to help you heal, and it literally tells your brain to release its own natural painkillers, those awesome endorphins. All right, so exercise is a no-brainer. We get it. It's essential. But, and this is the big but, this is the question at the very heart of this entire review. What happens when you add hands-on treatment into the mix? What's the deal with manual therapy?
This is probably the simplest way to think about the difference. With exercise therapy, you are the one doing the moving. You're actively doing the stretches, the strengthening, but with manual therapy, a therapist is moving your body for you. They're applying pressure, maybe doing a massage or a joint manipulation to get a result. So one is active, that's you, and the other is passive.
And this right here is exactly why this whole debate exists. Unlike exercise, which everyone pretty much agrees on, the evidence for manual therapy has been, well, it's been a mess. It's all over the place. As the study itself points out, the evidence is mixed. You've got government health guidelines in different countries saying completely different things. It's this confusion that the researchers were trying to cut through.
So that brings us to the million-dollar question, the one this entire scientific review was designed to answer. It's simple, really. For someone with chronic low back pain, if you add manual therapy to your exercise routine, do you get better results than if you just stick with exercise alone? That's it. That's the question.
Okay, let's get to the good stuff, the results. What did all this research actually find?
But before I just give you the answer, it's really important to know how they got it. Because this wasn't just one little study, they did something called a systematic review. That means they went out and found 10 different high-quality studies. We're talking randomized controlled trials, which are basically the gold standard in science, and they crunched all the data together, so the answer we're about to get is super reliable. And here it is, the big takeaway. It's actually pretty striking. In 8 out of the 10 studies they looked at, adding manual therapy on top of exercise led to bigger improvements in pain or disability than just doing exercise by itself. Pretty clear, right? Only 2 of the 10 found no extra benefit.
But of course, it's a little more complicated than that. Manual therapy isn't just one single thing, and this is where it gets interesting. When you look at the different types of hands-on therapy, the results vary. So, spinal manipulation, the results were kind of mixed. But things like massage, myofascial release, and muscle energy technique, yeah, those showed pretty clear benefits for either pain or disability.
Okay, but here's a really important catch, a crucial detail. The biggest bang for your buck with manual therapy seems to be in the short term. It's great for that immediate pain relief, helping people feel and move better right away. The science wasn't as clear on whether those hands-on benefits would last for the long haul all by themselves.
So, where does that leave us? What does this all actually mean for someone in pain? Let's put all the puzzle pieces together, because this is where we see how these two things work in synergy.
And boom, this quote right here is the aha moment of the whole study. This is the key insight. The researchers are saying, hey, these two things aren't fighting each other. They're a team. That short-term pain relief you get from manual therapy, that's what allows a person to actually do their exercises and to do them with confidence and accuracy instead of being limited by pain.
So you can almost think of it like this. Step 1, the hands-on therapy comes in and provides that short-term pain relief. It breaks the cycle. Step 2, because the pain is lower, you can now do your exercises and do them well. And step 3, it's that consistent, good quality exercise that gives you the real long-term benefits, the strength, the flexibility, the whole deal.
So really, the big idea here is that manual therapy isn't the final destination, but it might be the bridge that gets you there. Think of it like that. It's not the ultimate solution on its own, but it's the thing that helps you get over that first massive hurdle of pain so you can actually do the thing that is the long-term solution, and that's exercise.
Which kind of leaves us with a bigger question, doesn't it? When we're talking about something as complicated as chronic pain, maybe we should stop searching for that one single magic bullet treatment. Maybe the real answer isn't a choice between hands-on or hands-off. Maybe it's about finding the right combination of things, working together to help people finally move and live without pain.